the couple minutes between the focus group and us meeting was I ate a piece of fish. So yeah. So welcome everyone. Log in. Well, I guess if you're watching, you're already logged in. Is that feedback on my end? Do you hear that?
I hear nothing.
Oh, maybe. I don't know. Hopefully, if it's something people can hear, let us know, guys, if you hear feedback, and we'll figure out what's happening. I heard a little bit, but maybe we'll be.
I forgot I have to log in myself to see. Although that's right, I don't have to do that anymore because we have the comments. Although I can still want to share it.
Right.
I want to share it. So, but that's a little behind the scenes. So how are you tonight?
Not bad. It is. It's Wednesday, but it feels like Monday.
Does it?
And not in a bad way. It feels like there's still so much more of the week left, or that I need so much more of the week.
It's interesting. Of course, the weather has been all over the place, and yesterday was beautiful. I went on a bike ride this past weekend.
That's awesome.
And I, so my goal is to ride, like 30 plus miles, on my road bike on a weekend. It's asking us silly information. But I did 19.
Oh, that's awesome.
And
it
felt good. I mean, it was the first. I was just really going to see how my back would do. I'm doing all this back stuff, but I felt good, and it was. I rode from my house down to Niagara Square and back. Of course, had to go up Delaware Avenue and everything, and but it was just nice to be out. And I ride. On the way back, I ride going down Linwood. Towards, and you get that hill, you get that speed. Like when you get that speed
coming down,
and then you catch the lights. So you don't have to. That's like the best feeling in the world.
You're floating.
It's the best feeling, and I like and I also get that on Delaware. Cause I like going there. Like Niagara Square, I hit north, and I go down Delaware towards Niagara Square, and then once again, you just get this rush of air. And there's nothing like it. It's almost like you're flying. I'm flying.
And I think that's the part that people have to experience in order to know what you mean. Like there's such a sense of freedom when I'm on my bike, even when I'm tired. It's just I can't describe it, but because I haven't experienced it in any other format.
It's something about, I think in a way, it's like, we always talk about mindfulness and being present in the moment. It really forces you. I mean, obviously you're on a bike, you have to know what you're doing. You have to be paying attention to everything, but it's sort of like, it's exhilarating, and you're so focused that it really you can be in a way transported, to a pretty cool place.
Yeah.
So I'm really looking forward to, like, last summer, I didn't ride a lot. Last summer, I don't know what it was, but I just didn't get out as much. So my goal this summer is to do a lot more riding, make it a priority to do more, and make sure I set that time aside.
Yeah, I went to blow up my tires, inflate them, and the one with the racer thingies, I don't know how to work it, so I've got to take it to the shop. And then I couldn't figure out how to flip the air pump to be able to fit on the size thingy.
Because you have they're straight on Presta valves.
Yes.
And the road bikes have the Presta, which is the ones with the little valve you have to unscrew
Yeah.
and all that. Yeah. It's it's a little tricky.
So
Yeah.
yeah, I'm just gonna take it in and let them do it and
Yeah.
have them teach me how. But
Well, and but see, that's the point. You got to learn to do it yourself. You can't take that bike in every time you got to pump the tires.
well, no, but I broke it this time. I was trying not to go there, Carl.
Oh, I'm sorry.
The knobby part, bro. So they've got to show me. I'm not gonna. Yeah, you just teach me once and I'll be good.
Yeah. Okay. Cool.
Now that not tell the whole story. I mean, I could blow up a bike tire, but I broke the valve. I really can't.
Yeah.
So our topic
tonight, mental health in the workplace.
Yeah.
Which so a little background. When I worked at Mental Health Advocates of West New York, formerly known as the Mental Health Association Erie County, I helped to create a program. We first called it Brain Train. Didn't like that name. We rebranded it. Now it's called Mindset. It's still in existence, and it was created to develop, workplace wellness-based programs. And so we built this program. We got some training from the Canadian Mental Health Association, and so basically a suite of products. But the intent was to go into workplaces to teach about mental health, to teach about how managers and employees can learn ways to be healthier, but also be more productive. And it's interesting, and I'm sure you know too. But there's so much going on, like in the workplace. Depression is the number one cause of absenteeism in the workplace. Billions of dollars from just depression. Now, people don't say it's depression,
right?
When they call in, it's the flu, it's a cold, it's my kid is sick, right? Because of stigma,
right?
So. But depression is a huge thing. And so there are, of course, a lot of programs and like the American Psychological Association has resources and, other places, obviously. But, the way I look at it, every business of any size needs to at least be aware of how mental health can affect employees or managers, and what to look out for, because ultimately it's going to affect the bottom line.
Sure.
And not to mention the people. Of course, you hopefully care about the people, but it's going to affect the productivity, so that the company isn't as profitable if the employees aren't performing.
And so it's changing oftentimes company culture,
mm-hmm.
because it's not, in many cases it's frowned upon to address your personal needs.
Absolutely.
And they expect you to come in sick,
right?
Even when they tell you don't come in when you're sick,
right.
But the expectation is still that you show up.
Right.
There's no, mental health days. Some places are starting, you can call in for mental health days, but it shouldn't be something that is an exception, right? It's okay to talk about work-life balance and to make time for your kids. Like, you can call in because you need to take care of your family, but you can't call in because you need to take care of yourself.
Sure.
And that is again, promoting that caregiver, myth that caregivers are, these superhuman beings that are able to take care of everyone and themselves and their jobs and their, fill in the blank with all the other roles.
Yeah. So when I think about even my own lived experience, I've had different jobs, and of course my most memorable experience was actually just about 26 years ago. It was 1995. I was working at the Buffalo General Hospital Alcoholism Clinic as a counselor. I'd been married for about 7 or 8 months. and my wife was actually pregnant with our first daughter, and I experienced a manic episode.
Mm-hmm.
And, luckily I worked for an organization where I had told my employer, I told my supervisor, and of course the director knew of the program about my bipolar disorder. And so I was incredibly supported. I mean, to the point where even today I'm still blown away at how supportive they were, all things considered. I mean, granted, you are protected, as a protected class with a disability, especially if they know about it and it's made clear. But still, as you and I both know, there's always ways to kind of get you out the door if they want to. But the people like her, Pat Sullivan was my supervisor. Gary Baltz was the director, and they were great. So I had to take 3 months out of work, 3 months, to recuperate from this episode. It was brutal. I had the mania, but then I had this long period of depression, and then I remember having to come back to work in June, which is in itself was hard. I remember going back to work thinking to myself, I don't even know if I can do this. It was just hard to get going, but
Mm-hmm.
I fortunately made it. The thing also that was incredible though was I came back and I re-engaged, but they actually reassigned me to another job, working in the hospital, doing assessments that was significantly easier and less stressful. Plus, the hospital had a tuition reimbursement program. So actually, I think a year and a half, year or so later, whatever it was, I went back to school for my master's degree, and then Buffalo General Health got paid for it. So they were all cool with that.
Right. It all worked out.
It was a wonderful, wonderful thing. Now, as like I said, not everybody gets that.
Right.
And EAP. Yep. Exactly. Thank you, Victoria, for joining us again. Nice to see you again.
Which is, it is programs like that are so beneficial, and they're new, and a lot of people still are uncomfortable using them. They think that it's not confidential, and
they don't even know what they are.
Get a report back.
They're in the work. They don't know. Yeah, they don't know what they are. They don't know they're confidential, and yeah.
Right. A lot of people think that the EAP person is in the office right there, and you have to go in and, talk in the middle of human resources about whatever the issue is.
Right.
So, employers really, I don't know, and again, in changing that culture, really need to promote from the top, right? Not just from the supervisors, not just from the managers, but this has to be in all levels of administration.
Yep.
Culture change.
Yep.
Otherwise, the culture is not changing.
Right. Right. Oh, Candace. Oh, Candace from
Vicky.
Dale Evan Grider Community Center. Great to see you, Candace. She's mental health in the workplace, an area where much support and opportunities for understanding how to navigate with employees that may need help. Absolutely.
Yeah. And support your employees. Yeah. When we consider where we are right now between COVID and still racial injustice, we were talking about this earlier actually at work, how so many people are having these epiphanies, and they're finally, they are discovering for themselves, that disparities exist, that racism exists, and the slap in the face and re-traumatization that people of color face, because this is the life that we live every day. And so for someone to say, oh, I just discovered that racism is real, it's like, well, that's how did you just discover that? Like, we're still in this position of discovering things that have already been in existence, right? And so the mental health concerns that arise in just showing up to work every day, right? But if people don't think that there's an issue, if they don't think there's a concern, if they think just having EAP is enough and not really supporting EAP and letting your employees know, incorporating mental health days, things like that, like that's cultural shift, that's change.
Yeah. I think, of course, now with COVID, I mean, COVID changed the whole landscape of the workforce and the workplace. And I'm not just saying like not just in-person work, but remote working, everything has been shifted. And we know about how mental health is affecting everybody because of COVID, but it does. I mean, it bleeds into the workplace. It really, sometimes there's a lot of overlap between the personal and the professional, and vice versa. And like you said, sometimes people are wearing multiple hats, so to speak, or taking on multiple responsibilities.
Mm-hmm.
And what we need to stress is that when people are dealing with all these different concerns, something, if they don't get relief, then something's going to go, right? So we know that there needs to be some awareness and some understanding from management.
So let me ask you this question, since it's real talk time. Did you experience any anxiety or issues going back into the office or coming out of the office in that transition, or was it, kind of seamless for you?
Well, now you got to remember where I work. So, I was working full time, but now, in fact, I went part time as a contract employee and I'm happy to say, the Community Health Center of Buffalo, which is a phenomenal place to work, led by the esteemed Dr. Levon Ansari, who you well know. So it's a health center, Kelly. It's where would you rather be? At least in my eyes, where would you rather be than a health center that has very high standards when it comes to cleanliness and protocols? And in other words, when I go into work, everybody gets their temperature checked. You have to sign in, like if you're an employee, for contact tracing. All the visitors have to get their temperature checked. There's questions that are asked. So I mean, mind you, it's not your typical office, right? So I can't claim that my circumstance going to work is like going to, XYZ company or firm. So I don't think it's a good, fair comparison, even though some people might be concerned. I was a little bit at the beginning. I did, I'll be honest, I was, but once I realized that, you know what, I think it's going to be okay. I did adjust. I went back and re-engaged, and it didn't take long. I made that transition pretty quickly.
So being in the hospital setting, I felt the same way, right? There are people walking down the halls. Their sole job is to wipe doorknobs, right? Like the machines coming through, and it's just on this, cycle. It keeps going through the building, cleaning the floors, and people are their sole job is to clean. That's all they do, and clean the places you don't think need to be cleaned, like not just the doorknob, but like the side of the door when people push their hand instead of using the doorknob. But going to UB was a total shift. So I was home for many months, right? So working full time from home, which was different, but I mean, totally my element. Like I was just fine here. Went back into the hospital, and it was, an initial like, I don't know. I'll be walking through the halls, but then I'm like, I have glasses, I've got on a mask, I'm fine. But being at the university, it's a new environment. There's nobody there, right? So you really aren't talking to anyone. So I feel safe as far as health, but my anxiety level being like one of 10 people probably on the entire campus. Like if you look out the window, you see no one, right? You're in a ghost town. I actually looked out the window. I made a joke to a friend on the way in, and it was one of the days it was raining outside. That first day, it was like really horrible. And I'm like, today's one of those days. It's like a scary movie. You're trying to hurry up and get to your car, and the clicker doesn't work, and you see someone coming up, walking, they're getting closer to you, and you can't get in the car, and you drop your keys, like trying to press the button. Total freak out, right? But we laughed about it, and, I went on about my day. I went to go fill up my mug. As I'm walking past the window, I look out the window, and there's this guy in fatigues and like the big camping backpack and with a roll. Like, I'm on South Campus. I'm on Main Street. Like, where are you
Yeah.
going? There's no deer. Like, we're not hunting and camping. So the very first thing I think of course, is like, that man is here to eat someone. But I'm like, okay, because I'm the suite that has a lock. I'm in, Florida. Like, someone can just walk in, but still, anxiety super high.
Yeah.
Because I'm the only person in the building, and I'm not. I'm sure there's other people there, but I don't know.
Yeah.
I don't see anybody. I don't hear anybody.
Yeah.
Right? It's
That'd be weird. Yeah.
scary. It's freaky. Like, it really is.
Yeah.
It's so strange.
Yeah. My wife, so in my wife works at university too. I don't know if you knew that, but my wife works in HR, in organizational development. And so they just moved to Townsend.
Right next door. Yeah.
Yep.
So I'll probably see her.
Well, she's
not really
been working remotely from day one. Has not been in yet. She has her office set up, but will be, maybe going in. She just got vaccinated last Monday, the second one. So she's like, once she's good to go, she'll probably go in, maybe a day or two a week. But, the UB policy for a lot of folks, maybe not for everybody, but for a lot of folks, is if you're able to work remotely, they're still allowing that to some degree.
I do 2 in the office, 3 at home.
Right. So I'm saying, like, so you could do like a hybrid.
Yeah.
But think about this, Kelly. Not everybody has that.
Someone's going to work every day.
Of course, it's out there. You have to be on site. I mean, what if you're working at a grocery store, or what if you're working at the corner store? What if you're working, at the dry cleaners, whatever? I mean, there's a lot of places, small businesses, restaurants and takeout joints and all that you got to be there in front of the public. And that increases stress, anxiety, because you are on the front line. And we talk about frontline workers, but we certainly can't forget, it isn't just healthcare. It's a lot of other folks that are out there every day, putting themselves at risk. And we know that, some have actually been exposed to COVID and have gotten it. But I think, we hopefully, maybe turning a corner. But as far as the whole mental health piece goes, I just think, like I said before, it's important for managers to be sensitive to what their employees are going through.
And necessary. I mean, we're just in this it's not a new place of needing to express compassion, but compassion, you can't underestimate or over really the impact that compassion has, that empathy has.
Absolutely.
And it doesn't mean that you're crying together or, you're experiencing, the same emotions, but just understanding that people are in different places and have different needs. There's got to be a way to support the whole person in the workplace without it being, a policy. Right? Part of this is just humanity. And I would love for us to be able to get to the place where treating people like people, and not numbers. We were talking earlier about, the bottom line, treating people like people. If we could do that, we'd be golden.
Yeah, well, that's even before COVID, Kelly. That's a historical workplace thing.
Right.
Like I heard, I was listening to the radio, I think it was just yesterday. Yeah, yesterday. And I heard a story that the Amazon employees I can't remember what state, but Amazon employees in the South at a company are looking to unionize.
Yes.
You heard about this. And it's like it could set a precedent. And I mean, granted, many people, myself included, use Amazon. Guilty as charged, as they say. Am I fond of their practices? I hear about these things and it makes me wonder. Unfortunately, sometimes that's just where you got to go to get certain things. But still, I think, you talk about the right to work, the right to unionize,
Hmm.
um, and working conditions is what I'm saying. Like working conditions need to be conducive to good health. If
I
you
worked
are,
there.
yeah, if you are in a factory or a company that is just basically treating you like a machine, what does that do for you, right? It just it's like spitting you up and or chewing you up and spitting you out.
Yeah. I did a winter there at our local Amazon warehouse, sorting
Did you?
packages. I did. I,
What was
you
that
know,
like?
everything that they say it is.
Mm.
And it boils down to, I mean, is it manual labor? Yes. Are you on your feet the whole time? Yes. But it is the inability to, so I mean, the warehouse is huge, super long. And there's these, I don't know if I could, I think I signed something that I couldn't talk about the inside of the building. Anyways, by the time you get, by the time you get from one end of the building to the break room for break is over,
Yeah.
right? Like you walk in, you get your water, drink, whatever, and you sit down and break is over. Whereas someone working in an area that's closer to the break room, they get their full break. So that kind of stuff. It's working, and you got two people hauling these huge boxes, and then five other people are only taking small little letter packages. It's like, well, how is this possible?
Right.
And how is this allowed?
Right.
Right? You have this, trucks coming. It's shipping. It is what it is. But you have to the workload and the types of people that are doing this work do not match up.
Mm.
Right? I can't go back to Amazon and do a shift. I don't think I'd make it. I don't have the physical
Yeah.
capability. My knees wouldn't stand up. Right.
Yeah.
And there are people who have no business hauling those boxes,
Right.
hauling boxes because they have no other opportunity.
Well, and that's the thing too. I mean, yeah. I mean, unfortunately, you're right. Some individuals don't have other opportunities, and it's like either you work that job or you don't pay your rent, your mortgage, your kids, whatever.
Right.
Your prescriptions, whatever.
Right.
So,
And it's not like I'm doing this job because my kid wants to take piano lessons. Like nobody's slinging boxes at Amazon because they want to do a little extra, or this is their vacation money.
right.
Right. It is too arduous to have a part-time job that I just want to keep busy. That's not just a keep busy kind of job.
Sure.
It is physically demanding.
Yeah. Yeah.
Physically demanding.
Yeah.
So there's a lot of merit to, just from my experience, to some of the claims that I've heard. And then knowing that you're disposable, right? What does that do to your mental health? Knowing that, and not just, this particular
Well,
example,
yeah, and that your job,
board.
you can lose your job at the drop of a hat.
Right.
The uncertainty piece,
Right.
if you get written up, right? And so that's where like the right to work idea comes in some of these states, that you could be let go, with I don't want to say no cause, but you have no protections.
Right. And I mean, even if it makes sense, right? I'm late, X amount of times in a short period of time, and that is cause for write-up or termination or whatever. But if my shift starts, and I can't get there until 2 minutes after my shift starts because I have to take two buses or because I have to drop off a kid, I mean, there has to be some sort of, again, compassion and understanding.
Yeah. Well, and like I said, if you're working off the clock, so to speak, the The clock doesn't understand compassion understanding. The clock understands time. And
Right.
that's how, that's what these operations run on is time. And, clocking in, clocking out, breaks, lunch, and all that. And that is the nature of industry. I mean,
Yeah.
that's how it's been for a long time. And that's the thing too, like I know we're getting closer end of our time, but think about it this way: salary versus hourly. Think about that concept. In companies, salary, that's like already that's setting up a division. Let me tell you a story.
Yeah.
I'm gonna take you way back. I'm gonna take you way back. So when I was my first college, I went to a General Motors Institute. Uh, and it's called GMI. And GMI was an engineering school. And basically, it was a co-op where you go to school for 3 months, then you work for 3 months. And the work experience would be at a GM plant somewhere in the country. And I got my work assignment at Lansing, Michigan, at Oldsmobile. So I, went to school in Flint, Michigan, and then worked at Lansing at the Oldsmobile plant. And mind you, it was for like literally one semester. And then I crashed and burned. That's the whole story. But the thing's remarkable. I remember in so there's different buildings in the one plant setting. But I remember going to lunch, and there was a salary area, like section of the cafeteria, and there's an hourly section of the cafeteria. Like, in other words, it's almost like they didn't want people even to gather together. It was like, now I don't know. Mind you, this is 1980. So of course it's a long time ago. So it very well may not be like that, but that's the history of the workplace. That the division between a division of the workforce in terms of the haves and have-nots, you can almost call it.
And if you don't understand the foundation, then when it comes to changing culture, when it comes to, addressing things like mental health in the workplace, if you don't understand that dynamic exists, right, you're not really able to change the culture in the way that it needs to. You don't understand the culture in order to be able to change it.
Right.
That's interesting.
Yes, it is
you can get rid of the two sections, right? And now it's just an open cafeteria.
Right.
But if everyone still sits in the area that they used to sit in, it doesn't change anything.
Yeah.
The barriers they might as well still be there.
Yeah.
I don't know.
Yeah, I remember another quick story. So when I was finding myself, so to speak, I was in my 20s or early 20s, and I worked for a law firm as a temp, and I was kind of like a runner. I would deliver law journals to the attorneys and everything, and all these whatever. But my job was to go, like, it was actually in the Seneca Tower building. I won't say the firm, but it's still in existence, very prominent law firm. My job was to go and pick up these lunches, these bag lunches, and then deliver them to the attorneys, like office to office. Here, Mr. So-and-so, here's your lunch. Like with their little sandwich and their drink. And mind you, this is all billable. This is all billed, I think, to the clients. I think,
wow.
somehow. But then these guys wouldn't even look up. Like I was this low peasant, and I will never forget. This one attorney complained, I think one day, because I wasn't, like, I didn't wear some kind of, like, almost like I wore a sweater. He didn't like the way I was dressed. He complained to the law librarian who was my boss. I'm like, are you freaking kidding me? I was like, you pay for my jacket if you don't want me dressed like this. I was like, you have the audacity to tell me how I should. I mean, I got a tie on, damn it. What do you want from me? It was just, but anyway, but it was almost like, it was like classism. But it affected me, like it affected how I felt. It made me feel, of course it induced stress. I felt, less than all that. So anyway, there's a lot of these things that you said, like I said, are still historical that go on.
Right.
That are the divisions that are in place in the workplace that create mental health challenges for employees.
Agreed. And there's a process in place because I know that there is, like EAP, and other resources that people can utilize, that employers can utilize.
Well, don't forget the Equal Employment Opportunity Commission. If you have a grievance.
So talk about that while I'm putting up.
Well, basically, I mean, mind you, this is stretching my knowledge base here. But if you feel you've been discriminated against in any kind of way, or if your employer is acting, or even if an action has been taken against you, like a harassment or whatever, you can report that to the Equal Employment Opportunity Commission, and like file a lawsuit, right? If you want to take legal action. Now, mind you, that's a big step. It's a risk, and you got to be careful with that one. But people will go that route. Also, there's the Americans with Disabilities Act. That is also a very big one. If you live with a disability of any kind, mental, physical, or emotional, especially if it's documented ahead of time, or I'm getting a little fuzzy, so don't quote me on this, but I know that there's protections for people with disabilities in the workplace.
Yeah.
That if you are discriminated against, or if you're not given your proper accommodations, then you have legal recourse because you're a protected class.
And if you have questions about that, the New York State Department of Labor and your Human Resources Department would have more information.
And let me give another resource too, since we're on that, and this actually applies directly to our list of resources, which you put in the chat, which is wonderful, of the comments. The Mental Health Advocates of West New York, that's a great organization who I used to work for them. They have a legal advocacy department that will represent people, and so they handle civil law. So if you have a question, you can contact the MHA at 886-1242, and they will give you some free legal guidance. Mind you, you have to be living with a mental health challenge or condition to qualify, but it's a free service and highly recommended.
And with that, at 9:06 p.m., sir,
wow,
we have talked a little bit about mental health in the workplace, a little bit about adjusting to life during the coronavirus, and new racism, newly found and discovered racism in America. And you might have questions, and you might need to talk to somebody. You might need assistance. And so in the chat, there are many services that are listed. I'm still typing and copying and pasting, but if you are in need of resources, you don't know where to go, these folks in the chat may or may not be the place for you, and you're just looking for who to talk to, feel free to call or use 211westernNewYork.org, or dial 211 on your phone, and they will be able to look up a list of resources in your area regarding whatever the service is that you're in need of. Of course, if you're experiencing a medical emergency, please go to your nearest emergency room. If you are in need of someone to talk to, you're having a crisis, or you just need someone to talk to, you can call the National Suicide Prevention Helpline, and their number is 800-273-8255.
That number's changed.
Actually, that's not right.
It's officially changed to 988. I believe it's 988.
I don't know how to, so let's delete this one, and I'll put the new one in there. See, Carl?
Yeah, in fact, I had a comment from one of our viewers, private message, saying that it's live. In fact, she called it that night to check, and she said it's live. It's that area code thing that changes April 24th.
Yeah.
That's
so they didn't wait until April.
Not for the emergency number, but it's that area code thing that you're talking about that's changing.
Yeah, 988.
Which is separate. issue.
So I'll keep typing and you
Yeah.
do the talking.
Yeah. And like I said, the MHA, Mental Health Advocates, West New York, 886-1242. One thing I want to mention, though, tomorrow at noon on the Erie County Anti-Stigma Coalition Facebook page, we're holding a live panel discussion on the effects of stigma on military members and veterans. And I'm going to be facilitating the panel. Our guests include Chris Krieger from West York Heroes, Katie Couric, not NBC's Katie Couric or wherever she is now. She's not even NBC, but Katie Couric from the Veterans Department of, I think it's Suicide Prevention Coordinator. We also have Patrick Welch from the Community Veterans Engagement Organization. I'm not getting these titles right. I apologize. But Patrick Welch, local veteran and advocate. He also works with the Veterans Court. And lastly, Kathleen Larson from the County Department of Mental Health. So noon to 1 p.m. on the Erie County Anti-Stigma Coalition Facebook page.
Facebook tomorrow at noon EST. I put in the comments the fact sheet from the FCC on utilizing 988, which is the new 3-digit emergency suicide prevention hotline. So you have 911, you have 211, and we now have 988. So that is working. Thank you to our viewer who called and checked, because I wanted to call and I didn't want to.
I know you don't want to set the system off or get people, banging on your door.
Right. So if I'm calling, then everybody else must be calling too. So I won't. And someone did call. All right, folks. Until next time, and we'll talk about something else related to mental health. I am Kelly Marie Wolford of Front Seat Life LLC, and
I'm Carl Shalahorn from Shalahorn Consulting LLC.
And this has been Real Talk with Kelly and Carl. Until next time, be the light.
Be well.